Hi everyone, Dr. Nemechek here. I want to talk about this misconception that so many people are being given by health providers, whatever that means, about their systemic yeast problem. I've had a couple more people bring this up this week, and I just want to give you just some basic medicine microbiology 101. Okay. About this. One, what's a yeast? We have different organisms that live on or in our body. When I say in, I mean in the intestinal tract. And you have bacteria, you have archaea, which is like a primitive bacteria. You've got viruses, you have things called phage, you have things called protozoa, and you have things called yeast or fungi or mold. So like mold on a bread is a yeast or fungus. So fungus, mold, yeast are the same thing. In the body, we often say yeast. Now, everybody has yeast on their body. I have yeast on my palm. Everybody does. I have yeast in my armpits. I have yeast in my intestinal tract. Everybody does. Women have yeast in their vaginal vaults. Everybody does. Okay? Now, we all have yeast in our mouth. I have yeast in my mouth right now. Okay? Everybody does. We also have a lot of these other organisms in all these places. And it's this balance between all these different microorganisms that they help control each other. All right? Now, can you get a yeast infection? Yes. Okay. Do you have a systemic yeast infection? That's what people are. I've got some tests. I've got yeast in my blood, or it's leaking in my bloodstream and so forth. Unless you're watching this from your bed in the intensive care unit, you don't have that problem. Okay. You can get yeast on the skin. Okay. We call it tinea or ringworm is another word for that. You get in the toenails. You can have it in the folds of the skin that get moist, maybe on the bra line, the armpits, diaper rash. Some of that is yeast driven. You can have overgrowth of yeast in the vagina if a woman's getting oral antibiotics because the balance is thrown off there a little bit. Rare occasions, infants getting oral antibiotics might get a little bit of yeast growing up in the mouth. Okay. Other than that, you don't have yeast. Okay. You don't have yeast overgrowth. Okay. There's no known evidence that such a thing exists. People talk about SIFO, small intestine fungal overgrowth. There's no evidence that exists. All right. People talk about yeast causing leaky gut. Now, if yeast is breaching your barrier and literally causing leaky gut, you are going to die in 1 or 2 weeks. And for that to happen, you have to have a profoundly destroyed immune system. Advanced AIDS. Okay? Bone marrow transplant patient. Bad news. And it happens, you die. Yeast growing in your esophagus. Okay? Advanced immune deficiency. AIDS patients. Okay? Bone marrow transplant, organ transplant patients on these potent immunosuppressive drugs. Okay, so the patients will say, well, why do they say this? Quite honestly, I don't know. I think there's a lot of incompetence, I think there's some, it's a means to sell something to you, services and supplements and things like that. There's a misunderstanding that if I gave so-and-so a drug for Nizoral or fluconazole, which kill yeast. Sure, they can throw yeast balance off. And could you feel something different? Sure. Doesn't mean you have yeast in your bloodstream. Doesn't mean you have yeast overgrowth. Doesn't mean that at all. All right? And so it's just tossed around all the time. My advice, if somebody's like, you got yeast, 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 go somewhere else. Okay? because they don't know what they're talking about. If they don't know about that, which is a very fundamental thing, there's a whole lot of other stuff they don't know, okay, that they're getting wrong, and that's just for your own safety. And so anyhow, yes, yeast can occur. We all have yeast. You're never going to get rid of it. It's part of our biome over our entire surface of our body. It can cause some little problems on the surface, but if you have little ringworm or nail stuff, it doesn't imply your immune system's crappy and that yeast is going out through the whole body. It doesn't imply that at all. All right. People who have yeast that's breaching a barrier, getting in your body, or has made its way into the bloodstream of any level, you're basically going to die in a week or two. And at that point, you're already in the ICU. It's super severe. Super severe. Okay? So, that's it about yeast. It's not as bad as everybody thinks. And the important part of it is we're focusing on the yeast. We're really not focusing on what really might be causing your symptoms. Oops. Knocked over my microphone. That's all for today. Everybody, take care of yourselves. Bye.